Right. I'm not sure if 1 + 1 is 11 is mathematically correct, but thank you for your insightful talk. It's true that, especially here in Berlin, Germany, we do not think about snake bites too often as a global world health crisis, but that was very, very interesting. And I'm very happy to announce that we will now be joined by Esri's own Dr. Este Geraghty, Chief Medical Officer and Health Solutions Director at Esri Incorporated. Welcome, and over to you, Dr. Geraghty.
Thank you very much. It's a pleasure to be here. Guten Tag. Hello, everyone. So I serve as Esri's Chief Medical Officer in the United States, and I really am truly delighted to have this opportunity. Again, Dr. Asma, to share a conversation with you. We're making a very nice habit of this. And I want to thank you for your remarks in your keynote. You always really get right to the heart of things, and I'm anxious to dive a little bit deeper into a few of these topics. I know that WHO has a well-established history of working with Esri and with GIS, and you're really moving the needle on the world's most important health challenges. And I did want to explain a few things to this audience, since some of the patterns of how GIS is applied to health may be relatively new, though, of course, many have observed map-based news and dashboards related to the pandemic over the last 22 months. We're all familiar with those nowadays. But as you mentioned, WHO takes a really broad view of how to improve health with GIS. And I want to just give a few of the use cases here, and you really did mention those in many ways. You begin with what the public safety folks would call situational awareness, and health people often refer to a similar idea as surveillance, disease surveillance. WHO leverages data to look for clustering of diseases, what their possible causes might be, who are the most impacted populations, and what are their specific vulnerabilities to disease. WHO uses GIS to plan, collaborate, and mobilize emergency or interventional kinds of services. And they continually analyze and evaluate how well different populations are being served by health services. And especially one of the things GIS is good at is finding those gaps. And WHO is communicating with the public using GIS hubs and story maps to share important information. And you should definitely check out some of their story maps. They're quite impactful. And of course, all of this has been applied to COVID, but as you heard from Dr. Asma, they've been doing this for quite a while, whether they're working to eradicate polio, contain Ebola, further progress through the Sustainable Development Goals, or decrease deaths from malaria or venomous snake bites. WHO is using GIS for all of it. So, Dr. Asma, I think we have a fair amount that we could talk about today. And I'd like to begin by going into a little bit more detail about what you mentioned, the latest innovation from WHO, the snakebite envenoming platform. I mean, before you guys started advertising this, I hadn't really realized that more than 100,000 deaths per year are caused by snake bites from over 200 to 300 species of venomous snakes. And honestly, it gives me the heebie-jeebies a little bit when I think about that. And I actually live in a snake, I won't say infested, but a plentiful environment of snakes in the state of Nevada. And so I wonder if you could speak a little more deeply into that connection of why GIS is important to snakebite envenoming.
Sure. As you rightly said, this truly has been a neglected issue. And just a few years ago, WHO placed snakebite as a neglected topic. The reason is that it ought to get the attention that it deserves because it leaves many vulnerable communities disabled or prematurely risk losing their lives. The geography of snakes and where they are present in mainly tropical environments, but not all snakes are venomous or poisonous. There are about 3,000 varieties of snakes and only 300 are venomous indeed. And how does one distinguish? We are not here to kill all snakes. We want to maintain and protect the habitat as well. So there are many facets to this use case scenario that demonstrates that there is a neglected topic that has been long not addressed. So cataloging all the snakes and the varieties of snakes, and then understanding how many snakes and what are their characteristics, those that are poisonous. And different poisonous snakes have different antivenom that is needed when a victim is bitten by a poisonous snake. So how does those antivenoms are stored means that supply chain comes into effect. So one part is geography in terms of where the snakes are. The second part is about the treatment, the antivenom, and how it is transported and stored in the health facilities, and especially those antivenom that are paired with those venomous snakes. So it's a complex interrelationship and architecture. Then take a victim that is perhaps in a remote area or in a rice paddy field, imagine Vietnam, or imagine a tea estate in a hilly South Asian or Indian subcontinent. So we look at the topography and the geography, as well as where the health facilities are located, and the mapping of those health facilities, and the distance of where the victim is to the nearest health facility. So now triangulate all of these various characterizations of the snake, the topography of snake, the topography of the land, the medicine, and the healthcare professional. And then we need someone for transportation of the victim to the nearest health facility. And we need to know the road and the pathway to get the fastest. And GPS today tells us to avoid the road where there is more traffic, takes us to the shortcuts to the nearest destination and the fastest destination. So we are trying to leverage these technology solutions ultimately with the intention to save lives. So
I love this.
These are the fascinating details, and we are asking people to not kill the snake, but instead click a picture of the snake and mail the picture of the snake into the library. So then we can increase our database quality and know which snakes are more prevalent where, and also use public information. So as you rightly said, Este, it is about surveillance, identifying the gaps, finding the solutions, communicating to the general public, as well as making sure the essential services are available to the population at need.
Really all of the best of what GIS can do. And one thing that this audience may or may not have heard of that you've described so well is all of this layering of the information of the snake habitats and our surveillance of what's going on and putting resources in the right place, and the different natural environments in which this may be happening, venomous versus non-venomous snakes. This is a One Health problem, right? That overlaps
Absolutely. Animal
health, human health, and the environment. And some people may not have heard that term, but we in health are trying to look at things holistically to make things happen. You spoke in your keynote about partnerships, and because broad global partnerships and collaborations are so important in the work that you do, and just for all of us to be healthy, as we've seen over the last 22 months, I know that WHO is supporting member states, and some of those member states are resource constrained. So how does WHO help member states with implementing and modernizing their health information systems? And how is GIS helping all countries be able to participate in global health information systems?
Thank you, Este. And my message about 1 + 1 can be 2, but 1 + 1, when you visually look at it, 1 and 1, it can also seem to be 11. So the power of partnership is truly powerful, and we should not underestimate that at all. And Dr. Tedros, when he took the office 4.5 years ago, his vision to transform WHO to truly a modern data-driven organization. So we are accountable, and not only us as a multilateral organization, but countries and governments accountable to their own populations. So accountability is at the core of what we do. And we can't do this alone. We have to work with the countries, and we have to work along with the partners. And Dr. Tedros also says, let's embrace partnerships. WHO is good at certain things, others are good at other things, and we need to embrace those unique comparative strengths, so that when we all come together as one whole, we can leapfrog and accelerate and make an impact faster than we would have otherwise done alone. WHO, as you may have heard, announced in Berlin about 4 weeks ago that we will be establishing a Berlin hub for pandemic and epidemic intelligence. It is an effort to ensure that we are ahead of the game in terms of responding to epidemics and pandemics by bringing in technology, forecasting, setting scenarios. And similarly here in Geneva, we are planning to launch the World Health Data Hub that will have a direct channel with the countries in terms of how we exchange data in a secure platform. How do we make data available to our constituencies, public, private, our member states and communities and policymakers? And how do we truly use, again, the power of technology to translate data into stories? You already mentioned storyboards from GIS. It is very important for policymakers to quickly understand what the problem is and how they can quickly address that. And it is up to us how we help them translate data to policy impact.
Absolutely. You know, I know we don't have a lot of time, but you did speak about the breadth and the importance of GIS in improving health and saving lives, and I really appreciate your comments. But we both know that the potential of this technology is tremendous, but its use still remains low in health. So if you could give one piece of advice to your peers who are just starting to consider applying GIS for their innovative work, what would that one piece of advice be?
I'm a big fan of GIS, and I would like to say that GIS should become a universal tool in the public health toolkit. And I would like to see the use of GIS as a tracer when we repeat the assessment of data and health information system capacity in 2025. I would like to see every country utilizing the strengths of GIS technology has to offer, from, as you rightly said, in public health or disease surveillance, in terms of detecting, in terms of responding, in terms of maintaining essential health services. So I think this is an emerging field, and this is the right space and right time that we are in to truly leverage the power of GIS solutions to respond to public health needs, as well as you rightly said, One Health. We want public and the planet to be healthy. So GIS connects those two very, very nicely. So this is an area, if I had to study all over again, I would definitely delve deeper into the different aspects of GIS technology. So pursue and solve the global health problems with zeal and your full commitment. And we would like to hear from you and look forward to working with you and see what solutions you have to offer.
Excellent. Let's all definitely work together. And this is always, it's always a great conversation with you, Dr. Asma. I feel like we could continue to chat for hours. But I do want to sincerely thank you, Dr. Samira Asma, Assistant Director General for Data Analysis and Delivery for Impact at the World Health Organization. Thank you, Dr. Asma, so much for your time today, and especially for your efforts in fighting the world's most challenging health problems. And Daniel, I'll turn it back over to you.
Thank you so much.
Thank you very much, Este. Thank you, Daniel.
Thanks to both of you. Keep up the excellent work. Thank you.